cannot enter the brain. So what's the meaning of this? Only lipid soluble, non-charged particle, less molecular weight only can reaches the blood-brain barrier. If you want to give the treatment or act the drug on the brain, we have to select lipid soluble drug. If you want to protect the brain, we have to select the water soluble drugs. Passage of the drugs to the fetus. It is important factor. So many doctors will advise to not take the medicine during the pregnancy because so many drugs will be cross over the placenta. It will affect the fetus. So for example, thalidomide, in the early stage for the morning sickness, doctors prescribe this thalidomide. It will cross over the fetus barrier, the fetus barrier, blood placental barrier. It will affect the baby. That's why the babies are, they got the babies as the focomelia, sealed like limbs. That means without hand and without legs only they got the babies. That's why this is the this can be restricted by the here also lipid soluble drug and also molecular weight less than 1000 Daltons only cross over this this barrier, blood-brain barrier. So, if we want to protect the baby during pregnancy, we should not prescribe the lipophilic drugs. Only water-soluble drugs we have to prescribe. Next. This is the volume of distribution. After the distribution, how much the volume of distributions? If the drug is homogeneously distributing all over the body, if it is distributing the all of body homogeneously without any variation, we can use this formula. Dose administered IV, plasma drug concentration. How much dose administered and what is the plasma concentration? If the dose administered is 1000 milligram, plasma concentration is 50 milligram per liter, the volume of distribution is 20 liter, 1000 by 50, 20 liter. Kinetics of distribution. But already we have studied 4 patterns are there, distributions are there. That's why sometimes we cannot consider the body as a homogeneous compartment. Some variation will be there because in the blood plasma, liver, kidney, heart, high concentration of the blood will be there. But there only the how much amount of the blood is there. But in other organs, skin, skeletal muscles, bones, there will be the less blood supply. That's why less drug will be there. That's why through calculation we can be consider this as a 2 compartments. So each individual organ we are considering as the compartment. It's difficult to calculation. That's why we can total body we can be considered as the 2 compartment. That is compartment, central compartment. The highly perfused organ and the blood we can consider as the central compartment and other we can consider as the peripheral compartment. So the elimination will be takes place only through the central compartment. The drug will be distributed between the central compartment and also the peripheral compartment. Next, third parameter. Are you feeling bored? Biotransformations. They try like this seminar only we can understand the situations of our students. Biotransformation. What is biotransformation? So normally all the chemical components having the structure. So already you have studied maybe the all chemical concentrated drug ingredients which are there in the drug molecules at the plant. That all each alkaloids are having one chemical structure. Glycosides are having another chemical structure. These chemical structure will be get altered during the metabolism. This one bio. This metabolism is takes place in our body. That's why we are calling this metabolism as a biotransformation. Our body transforming the structure of drug molecule. Our body transforming the structure of drug molecule. So it is called as biotransformation. Here, normally urine, what is maybe there much amount of liquid is there or water is there in our urine? Water is there. So water soluble drugs only can be able to pass over this urine. Otherwise lipid soluble drugs does not pass through urine. This is the major organ. So other skin little bit sweating there because always we are sitting in the AC room and also that's why the sweating is less there. Absorption will be reduced whenever through the skin because lipophilic drug can be excreted through the skin. But main organ which is used for this is excretion is kidney. So all the drugs, whatever the drugs we are taking, maybe lipophilic drug or hydrophilic drug, everything, the mostly our body converted into water soluble. That is this biotransformation. Just you think, this system is not installed by God in our body. all the lipophilic drugs will be entangled here, accumulated in our body, it will produce the poisonous effect. That's why, because of the God's grace, the system, biotransformation system is there in our body. So, water-soluble drugs only will undergo renal excretion, because lipid-soluble drug excreted from the glomerular filtration, but it will be reabsorbed. That's why only water-soluble drugs will be excreted. That's why if lipid-soluble drug continuously accumulates in our body, it will produce the toxic effect. If lipid-soluble drug continuously reabsorb and accumulate in our body, it will produce the toxic effect. To prevent that, only this metabolism converting the drug to water, convert the water-insoluble lipophilic non-polar drug into it is polar water-soluble product. All the lipophilic drugs are converted into water-soluble products. That's why it can be excreted. So just metabolism converting the structure of drug. So anyway, it will be make the lipophilic drug into water-soluble drug. So normally, what is the need of metabolism? What are the metabolic reactions are happening in our body? Normally, the metabolism leads to pharmacological inactivation of drug. Activity will be there. Whenever administering, activity will be there for the drug. Normally, it will lead to inactivate the drug, change the structure and the alkaloid structure. If there will be the alkaloid means nitrogen genus base will be there. If the nitrogen is not there means the structure will be varying. That's why pharmacologically inactive drug. That is phenytoin example. I don't know the proper Siddha example. That's why I have taken this allopathic example. Phenytoin, that is the anti-epileptic drug. Fixed use பண்ணக்கூடிய drug. After the metabolism, it will convert into para-hydroxyphenytoin. This is inactive form. Then only it will be excreted. Next, occasionally, sometimes, it will yield the metabolites of equal activity. Whatever the drugs we have given, that same activities will be remains in the metabolites also. For example, digitoxin, your drug only, digitoxin, treatment for congestive cardiac failure. The digitoxin, after the metabolism, it will be converted into digoxin. Digoxin, the conversion does not change the metabolic activity. Whenever it is excreting itself, also it will be in the active form. The next one is rarely, sometimes the metabolic reaction produce the toxic product. So always, if there is any fever, immediately we will get the paracetamol in the medical store. Without going doctor also, we will take the paracetamol. But that paracetamol produce the hepatotoxicity. Liver damage will be produced the paracetamol, because the paracetamol in the body by the metabolism, it is converted in the hydroxyl metabolism. It will damage the liver cells. Next, prodrug. This is prodrug means inactive form of the drug. Whenever we are giving, it will be inactive form. After the metabolism, it will be converted into active form. Inactive drug converted into active form, prodrug. For example, aspirin, everyone knows this aspirin. So pain relieving agents, non-steroidal anti-inflammatory drugs. This aspirin is a prodrug, inactive form of the drug. But after the administration, during the biotransformation process, this aspirin will be converted into salicylic acid. That is the active form, that only relieving our pain. This also can be absorbed. Sometimes the pharmacological activity also changes. Rarely, very rarely, pharmacological activity of the drug also will be changed. Iproniazid, this is the antidepressant drug. Then, after the metabolism, it will converted into isoniazid. This iproniazid converted into anti-tubercular drug isoniazid. So, antidepressant drug, for the antidepressive purpose, we have given the drug. But after the metabolism, it gave the anti-tubercular effect. This is the effect of metabolism. Some organs, so not all the organs which are there in our body is involved in the metabolism. Some specific organs are involved in the metabolism. Main organ which is involved in the metabolism is liver, major organ, because number of microsomal drug metabolism enzymes are there in the liver. Yes, in the liver. Second one, lungs. Next, kidney, gastrointestinal tract, placenta, adrenal gland, skin. Minor quantities through the brain, testes, muscles and spleen. So enzymatic reactions. Everything there will be the step. So immediately for preparing In the kitchen we are making the food also, there will be the step. First we are taking and cutting, then before that washing, washing, cutting, then only we are preparing the food, like that. In this metabolism also there are two phases. First one phase 1 and another phase 2. Phase 1 and another is phase 2. This phase 1 consists of oxidation, reduction, hydrolysis. Maybe you have studied in the school life itself. Oxidation, reduction, hydrolysis. Oxygenation, ஒடுக்கம், நீரார் பகுப்புதெல்லாம் படிச்சிருக்கோம். Oxidation, reduction, hydrolysis. This is the phase 1 reaction. And second reaction is conjugation reaction. Conjugation, joining. Conjugation reaction, phase 2 reaction. First we are giving the drug, that any drug that is involved in the first step, that is the phase 1 reaction. Phase 1 reaction. That is only making and adding some polar compounds. Polar means water soluble compounds with the drug. Okay, water soluble compounds. That means the otherwise it does not diminish the water soluble compounds already is there in the drug molecule. Yes, polar functional group is introduced or unmasked the already present polar groups. Are example hydroxyl group, carboxyl group, amino group, sulfitryl group. These groups will be introduced by the phase 1 reaction to the drugs. Now it's ready for phase 2 reactions. The phase 2 reaction, what is happening? Covalent attachment, that means the electron transfer reaction. By that, the drug molecules will be attached with the endogenous compound, means the components which is there in our body. With that endogenous compound, that is the water soluble component which is there in our body, with that it will join. Now it's become highly polar. Already the partially is got polar by the phase 1 reaction. Now it's completely polar. Now it is used, it can be easily excreted through the urine. This is the steps, phase 1, phase 2 reactions. Now these components only, the conjugation, endogenous substances, example gluconic acid, sulfate, glycine. These are there in our body. That component attached with the already formed this phase 1 product, otherwise directly with the drug. Anyway, after the phase 2 reaction, it is ready to eliminate through the kidney or liver. Next, first reaction, oxidation. Oxidation is nothing but it is the addition of oxygen or removal of hydrogen. And oxygen molecule will be attached with the structure, because this is only structure change, metabolism. Oxygen molecule add with the structure or hydrogen molecules removed from the structure. This only happens. For example, ethyl alcohol. With that, here what is happening after the oxidation by the enzymes are very important for oxidations or anything metabolic reaction. Enzymes are required. Already in our body much number of enzymes are there. That enzymes are targeting or leading these metabolic reactions. So here the ethyl alcohol is converting into acetaldehyde. Here which is the enzyme? Alcohol dehydrogenase. Alcohol dehydrogenase. Then this acetaldehyde is converting into acetic acid. Here only got the